Testing for heavy metals is frankly quite confusing, so confusing that many practitioners, myself included, just ignore it.
Don't ignore it.
So I'm trying not to ignore it, but let's just start with what symptoms should trigger me, you can just talk to me, to do a heavy metal evaluation in somebody.
Well, I would say every single patient who makes an appointment with you should be given an environmental exposure history intake along with their medical history intake.
Okay.
And the reason being is when you look through the exposure history intake, one, it's when patients fill it out, it's very informative to them. They're like, oh, I didn't realize I was exposing myself here, 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 here.
Right.
But two, as a physician, then reading that in conjunction with their medical history intake, if you understand the links between metals and perhaps their disease, you can say, look, this might be contributing. There might be a correlation here. But even conditions that a lot of physicians don't realize are linked to environmental toxins, they can see that. So, for example, hair loss.
Okay.
A lot of patients have hair loss, or ringing in the ear, tinnitus. Those can be linked to mercury, both of those conditions. I have patients, that I can tell you stories about. The gentleman who ate tuna fish sandwiches 3 days a week for years. He worked in construction. His wife sent him to me because he had ringing in the ears. I thought it had something to do with his construction job until I really looked through the exposure intake. And on my intake, I asked about fish. And bingo, I was like, I should test him for heavy metals. And his blood mercury was off the charts. We eliminated the exposure. He couldn't eat tuna sandwiches anymore. And I treated him, and his ringing in his ears completely resolved.
Yeah, so interesting.